Hello, Colorado. Today's COVID update, we're going to talk about boosters, who should get them, where you can get them, also some of the innovative testing programs in our state. There's a testing available in so many different ways, through schools, Binax at home, through employers, state lab and community testing, your local hospital, commercially available. There's many of those available. So we have Dr. Emily Travanti, the director of our state lab, who's going to give us an overview of testing in Colorado. Briefly, before we jump into COVID, there's a 60-acre fire near Silverthorne. There is an evacuation of about 300 homes. So it's a very small fire, but it's very close to homes in the area on U.S. Forest Service land. The local sheriff and folks on the ground feel confident about the containment of the fire. It's a relatively high-profile fire, given its location in Summit County. And fairly close to some homes. But we feel good about that. The Colorado DFPC multi-mission aircraft flew the fire overnight. And we are hoping for the best as the state supports the locals. In Colorado, we have 1,897 new COVID cases. We seem to continue to be at a plateau to slight decline, still a high incidence of COVID across the entire country. Colorado continues to have the sixth lowest rate of COVID in the country, but it is still very prevalent here, and people should, of course, take precautions as necessary. If you're not vaccinated, get vaccinated. And even if you are, good idea to, when you're around a lot of others indoors, wear a mask. 866 hospitalizations, and just to put things in perspective, of those 866, only 164 of the 866 are vaccinated Coloradans. So you have 164 that are from that 76% of the adult population that's vaccinated. And then you have all the rest of the 866, in fact, 702, that are from that 24% of the population that isn't fully vaccinated. So it really just starkly shows vaccination works, significantly reduces your risk of contracting the virus. If you do contract the virus, it significantly reduces your risk of hospitalization and your symptoms. And if you are hospitalized, it significantly reduces your chance of death. So at every stage of the process, vaccine works as advertised. Please get vaccinated. For children, we have 18 kids in our state hospitalized for COVID, 12 that are 0 to 11 years old, and 6 that are 12 to 17-year-old. We continue to have an elevated incidence of COVID, as the entire country does. We hope that we are seeing the first signs of a small decline. We hope that that picks up, and that is simply a function of people getting vaccinated, getting protected, and the precautions that people take around others, like masks and social distancing. Last week, we got very exciting news from the CDC and FDA around booster shots for those who got the Pfizer vaccine 6 months ago. I want to be very clear, it's very simple. The recommendations for the CDC are essentially everybody that got the Pfizer vaccine 6 months or more ago. And because in our state at that time, and I think this was the case in other states, but I'm speaking for Colorado, the folks that were getting it at that time were over 65, and they were frontline essential workers. Both of those categories now qualify for the booster, along with people of all ages with pre-existing conditions. But in our state, most of them are not yet coming up on 6 months. But if for some reason you are, by all means, get the booster. The booster has shown amazing results in antibody response in several studies, and in real-life protection, increased protection from a study out of Israel. And my parents have gotten their booster. I encourage you to get yours. I am not yet at 6 months myself, but I certainly plan to do it. You saw President Biden got his booster. It makes sense to do. And for those who have any kind of retail job, teacher, frontline work, 65 and up, if you got the Pfizer vaccine 6 months or more ago, go ahead and get the booster. If you got Moderna 4, 5, 6 months ago, if you have a weakened immune system, you absolutely can get a booster as well. You simply attest that you have a weakened immune system, and you will be able to receive that vaccine at your local pharmacy or doctor's office. Because of the need for boosters, we've also set up some medium-scale community sites. These are the popular drive-through sites. Many of the people in the first round got their vaccines that way and want to do that again for their booster. And we're happy to make those available in Aurora. The Aurora Municipal Center drive-through clinic, open 9 a.m. to 7 p.m. Littleton Southwest Plaza Mall, 10 a.m. to 7 p.m. In Colorado Springs, the Chapel Hills Mall, that's a walk-in clinic, 10 a.m. to 5:30 p.m. And Dick's Sporting Goods, walk-up, 11 a.m. to 9 p.m. But there's also 1,600 providers across the state of the vaccine. Any one of them can give you the booster when you fit the criteria. Pharmacies, hospitals, community health clinics, your local doctor, all available. And with the high level of the virus we have, I know you want that extra level of protection, so please take up that opportunity to go ahead and get that booster. We are at 3.9% of adults in our state have gotten their third dose or booster dose. So just about 4%. We expect to pass 4% today as people opt to get that extra level of protection, as my 77-year-old parents have. Across the country, we are also seeing an increased demand in COVID-19 testing with the higher prevalence of the virus. We all know that that's for several reasons. As an individual, you want to know early because there could be treatments available to you. There are treatments available to you early in the diagnosis that are not effective later on if you wait to see whether you need to be hospitalized or not. We also care a lot about testing at the population level because the sooner people know and self-isolate, the lower the R naught, the less the spread of the virus. Very important to identify early. There are a variety of testing programs to meet the needs of Coloradans. Just to put things in perspective, we started the pandemic early March of 2020. Our state, like many others, had very little testing capability. There was about 200 tests per day at that time. Now, the state itself and our community partners in the state lab can do about 40,000 tests a day. And there are many other private labs that operate in hospitals that operate in our state that can do tens of thousands of more each day. In addition to our school testing capacity, which is tens of thousands each day, and the really a much better state of testing to help prevent the spread of the virus and help those who contract it identify the virus early in the course of infection so that they can take the treatment that will increase their odds of living, decrease their odds of hospitalization. The executive director of the state lab is Dr. Emily Travanti. She has worked to scale the state lab to be able to do the number of tests they do today, worked with some of our private contractors to be able to scale that up. And with that, I'll turn it over to Dr. Travanti.
Thank you, Governor. Good afternoon. I'd like to provide for you today some updates on testing capacity in the state of Colorado at this point. If we look back to the beginning of the pandemic in April 2020, the state laboratory was the only option for performing testing within the state of Colorado and could perform approximately 160 tests per day. Today, we're proud to say that through efforts of scaling at the state laboratory as well as our commercial testing partners, we can now perform over 39,000 tests per day. This testing capacity includes our community testing sites as well as the tests performed at the state laboratory. We are now able to say that we can offer free testing to anyone in the community at over 110 community testing sites across the state with 8 community testing vendors using 10 different laboratories. We're currently averaging 8,930 tests per day at these sites, or over 60,000 tests per week. And we are well within our current testing capacity. We're only using about 27% of the capacity that's currently available statewide, and we're continuing to scale that, looking to add additional sites over the next few weeks. We encourage anyone with symptoms or exposure to access this free testing. Next slide. Testing currently is running a turnaround time on average in Colorado around 2 days, meaning that patients should receive their test results quickly. When testing demand increases, turnaround times can also increase. The testing team is closely monitoring turnaround times as one of the metrics we use to determine if additional testing resources are needed to meet the demand in a specific area. In the past month alone, we have added additional testing sites in both Weld and El Paso County to increase demands in those areas. Next slide. The community testing sites are just one of the layer of testing options that we offer within the state. The community testing sites are located everywhere and make testing free and accessible to all Coloradoans. Additional testing tools in the state include our pharmacy and ICAT testing, or increasing community access to testing. These are federally funded programs that allow people to go directly to your Walgreens or other select pharmacies across the state to access testing. Additional testing tools that we have available in the state are the BinaX professional tests. These tests are supplied to organizations that have a certification and can provide on-site rapid testing, including long-term care facilities, congregate care settings, healthcare, essential services, education, state and local government. In addition to the BinaX testing, we also have our school testing program. CDPHE is providing testing supplies and even staffing directly to schools that enroll in this free program, allowing schools to conduct screening testing as part of a layered approach to protection against COVID-19. And the final testing tool that we are currently offering is our rapid at-home testing. This testing allows individuals to access tests directly at their homes, and these tests are shipped directly to your home when you sign up on our website. Next slide, please. A little more detail on our school testing program right now. This testing program uses rapid antigen testing directly in the schools. Schools can opt into a program in which they receive testing supplies, or if they choose, we can supply the staffing as well to go directly to the schools and perform testing on the students. We currently have over 5,000 students that have active consent on file. We have administered close to 4,600 tests to students, as well as 2,367 to staff. And at this point, we have seen 61 positive tests in the school settings. We currently have over 600 interested schools, and 439 schools have completed enrollment, which means that they have completed all of the paperwork and are working with our vendor to set the testing up in their school facilities. We have a map here that shows the density of locations around the state that have currently enrolled, but I'd like to point out that any other school that would like to enroll can still enroll. This is an ongoing program that accepts enrollment. We applaud the schools who have signed up already and are actively testing their students and staff, and we encourage even more students and districts to sign up for this free program. The website here, covid19.colorado.gov/free-testing-schools is where you can access sign up for this program. Next slide. Some more details on our rapid at-home testing program. This program was just announced last week, and we're pleased to say that to date we have shipped 70,024 tests directly to Coloradoans' homes. Demand is currently exceeding capacity, which is what we wanted to see. We're glad that Coloradoans are utilizing this program, and we're working to create a queue for people who are interested in placing an order for this testing. We encourage everyone who participates in this program to report their results to the state. To access all these testing resources that CDPHE is providing for Colorado, visit covid19.colorado.gov/testing. Here you can see the community testing sites, which are located across the state and make testing free and accessible to all. You can also gather more information on which pharmacies are participating in the Pharmacy ICAT program, which makes the testing available in these select pharmacies. You can access information on the BinaX professional testing to provide supplies directly to organizations such as our long-term care facilities, as well as sign up for the school testing or follow links to get the rapid at-home test delivered directly to your door. Thank you.
The school testing is available free for private schools, charter schools, public schools. Please, we want more schools to implement that to have a significant impact on reducing the spread of the virus, so please encourage your school to do so. And I want to thank Dr. Emily Travanti. These efforts combined, whether it's the at-home test, the school-based test, the community testing, support for private testing, is really part of the innovative spirit here in Colorado, and a big part of the reason that we are one of the lower states in terms of fatalities per capita, and we're the 6th lowest in terms of COVID rates today. And I'm thrilled to see that so many Coloradans are looking to utilize the at-home rapid testing program, which we're looking to scale up. We want more people to use the programs that have more capacity than demand, namely the school testing program. We could do significantly more on that if we had the interest in the testing as well. Employers from many private companies, federal workers, some of the state workers that work in long-term care facilities have requirements coming in for them to be vaccinated. The Colorado Board of Health has specifically required vaccines for many people that work around others in healthcare. To be clear, that is also required federally. Any hospital that doesn't do that risks losing Medicaid and Medicare funding, major funding sources. So there's been a lot of excitement that we've heard from healthcare workers to know that their colleagues and those they work alongside will be vaccinated and have a lower degree of transmission. A lot of our hospital workers are tired and burnt out, and I think this comes as needed relief to them. And in fact, more than 1,100 healthcare workers have been vaccinated against COVID-19 since the Board of Health took their actions. Really, everything we've discussed today is an important step in the right direction. But as we all know, we are in a pandemic. It is largely at this point a pandemic of the unvaccinated. If everybody was vaccinated, there simply wouldn't be concerns about hospital capacity or anything else. But until that point where more folks get vaccinated, we are still in the pandemic. And it's unfortunate that those of us who have done the right thing, have been vaccinated, are still dealing with the consequences of the choices that others have made. The vaccine is key to fighting the virus. We also can't dismiss the significance of other strategies that are also important. Testing, mask wearing, avoiding large indoor gatherings in tight spaces if you do go wearing a mask. In Colorado, we're all of the above. We're using vaccines. We have one of the highest rates in the region, one of the higher ones nationally. That's why we have a lower COVID rate. Testing, mask, delivery programs, free medical grade masks to schools, testing in schools. We are leaving no stone unturned. There is no one silver bullet. The vaccine is the single biggest bullet in our arsenal. But if we just said vaccine and nothing else, we would have a lot more hospitalization and deaths today. So it's vaccine plus. Until the pandemic is over, we're leaving no stone unturned to protect our communities, to power the Colorado comeback, and to save lives. With that, I'm happy to take some questions.
Governor, can you hear me?
Yes, go ahead.
Okay, I'm Jesus Carrasquel from Noticias Univisión Colorado. Gobernador, I have two questions in Spanish for you. Gobernador, ¿cuáles serán las estrategias para garantizar la tercera dosis de la vacuna del COVID-19? Y además, a pocos días de finalizar el mes, ¿tendrá contemplado ampliar la moratoria del desalojo en el estado?
Ok, voy a contestar los dos. Actualmente hay muchas maneras para poder obtener la vacuna en Colorado. Hay más de 1,600 proveedores que pueden dar la vacuna, como el farmacias, su doctor, nuestro centro de vacuno, clínicas. Estos mismos lugares pueden ser utilizados para el booster, especialmente para toda la población mayor que 65 años. Por la segunda pregunta, Colorado no ha tenido un moratorio por varios meses. Lo que tenemos actualmente es una orden ejecutiva que extiende el periodo de proceso de desalojo de 10 a 30 días. Next question.
Governor John Frank here. I want to double back to this at-home testing. It's taking weeks for folks to get these tests. What are you doing to speed up that process? And is there any concern that you won't have enough tests to meet the high demand? Thank you.
Well, yeah, first of all, we're thrilled with the reception of it. We always want demand to be more than supply. We are currently trying to increase demand for our school testing program because our supply and capacity is far greater than demand. So this is great. It means every test we get is getting out into the field without delay, somebody who wants it, somebody who will use it, and that will have an impact on the epidemic. We are estimating 7 to 14 days wait time. We think that supply and demand are roughly converging. There was an initial larger demand of over 10,000 a day for a couple days. Demand is now about 5,000 a day. And as we work through the backlog in the next week to 10 days, if it stays stable, we expect that we'll be able to, on an ongoing basis, meet that demand within a week or two for the at-home testing. Currently, the at-home testing is 8 tests per order. That then is designed to last for 2 months if people test themselves once a week. If you're testing 2 people out of that once a week, it would last 4 weeks. We hope that some who utilize that might then renew it at that point. We are also looking at the potential to break apart the 8 into smaller units of 4 so that more people can get 4 tests instead of 8 tests sooner, as well as talking to Avid about front-loading more of our order. But overall, we're thrilled with the demand. We're excited that they're not going to be sitting around and that the Avid at-home tests will be widely used.
Hello, this is Meg Wingeter from the Denver Post. I have 2 questions. You talked about wanting to increase the demand for the school-based testing, but why not just, if those tests aren't being used, put them toward a program where there's currently a backlog? And my second question is, you talked about now we need to be thinking in terms of not just the vaccine, but vaccine plus all these other precautions. Where did your thinking shift on that?
Could you elaborate on your second question, please?
Well, earlier in the summer, the emphasis was very much on getting everybody vaccinated, then we won't use additional precautions. And it sounds like you're taking a little different tack on that. And I just wanted you to elaborate a bit.
Sure. On your first question, the at-home tests from Avid are the only ones that you are approved for your use. They're very easy to use in your own home. The contracts for the school testing is done by a couple of contractors that come in and do that work. So when we have extra capacity there, that does not mean that there is a test that can be shipped to somebody to use at their home. They're different things, as is the community testing, as is the testing that's processed at the state lab. There's a variety of testing that's done in our state, and in most of it, the capacity for doing it far exceeds the demand. We're excited that in the initial weeks of the Binax at home test, there is more demand, which is great, and we're going to work with Abbott to increase the supply of that. In the meantime, we hope that the demand increases for particularly the school testing program, which is federally paid for and can serve 10 times as many kids as it currently serves if people would opt into it. There's also a way that in many parts of our state, parents can receive, or the kids can receive $10 a week for participating in that if they choose to. On the second one, the vaccines are highly effective. We talked about leading off, only a small fraction of our 866 people who are hospitalized in Colorado today from COVID are vaccinated. The vast majority are unvaccinated. It's the same across the country. This is a pandemic of the unvaccinated. Until more unvaccinated people get vaccinated, it is a smart thing to do to wear a mask around others in large indoor gatherings, to be social distant where you can, and to just be cautious about the high level of spread in the community. If you're vaccinated, the risk is less to you, of course, but you still can transmit it to others. And with so many unvaccinated folks around, it could easily be deadly for somebody, perhaps somebody, one of your neighbors or friends who might not have had the chance to get vaccinated yet.
Thank you.
Governor Polis, Sarah Flower with KSUT Four Corners Public Radio. Also, we're without a huge buy-in as you anticipated with the school testing program. Would there be an opportunity for you and your staff to mandate masks within the school setting, as those are highest, not only case rates, but outbreaks throughout the state?
Well, we see a very small number of young people hospitalized in our state. I gave the statistic earlier. I think 18 people under the age 17 and under are currently hospitalized in our state. There is no pediatric bed crisis currently. Schools are doing a great job ensuring that they have a safe environment, whether it's testing, mask wearing. For schools that don't want to implement mask wearing, having universal testing of students is a great alternative. It's free. The state will support it. They can implement that. Some schools that want to be particularly cautious can do both. They can do mask wearing and universal testing. So there's a lot of options for schools that are out there. We in the state stand by ready to support schools in being safe places to learn.
Yes, this is Julie Martin with KKTV. I was at the Otero County Commission meeting yesterday when they voted, or they signed a resolution opposing the state vaccine and mask mandate. And the Arkansas Valley Medical Center says they'll lose at least 26 nurses if they're not exempt from the vaccine mandate. What do you have to say to the rural communities struggling with these mandates?
Well, first of all, I think that they're directing their attention in the wrong direction. They will lose federal Medicaid and Medicare funding, which is without which they don't have a viable business model if they don't accomplish the vaccination of their staff. And we do hear from the vast majority of their staff in Otero County and the majority of healthcare workers across the state that they are very relieved that the handful of their colleagues who haven't yet been vaccinated will either be gone and remove that threat from the workplace or get vaccinated. So I think what we hear from rural Colorado is a collective sigh of relief from the vast majority of healthcare workers in rural Colorado who are already successfully vaccinated.
One more question?
Who's the last one? Lauren, go ahead. Having technical problems. Is there another one? Okay. Thank you all very much. Have a wonderful day. Be safe.